to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thanks so much, Margie, and thank you to all of you for tuning in to learn more about the latest local developments and how to help end this pandemic. Now this week, our community has reached 3 major milestones in our efforts to end the pandemic. The first is the new position on our COVID-19 risk dial. After being in mid-yellow for 9 consecutive weeks, the dial is moving to low yellow. And this is the first time that the dial has ever been in low yellow, and it is the lowest risk level we have achieved as a community since the dial was launched nearly a year ago. The yellow level indicates that the risk of the virus spreading and the impact on our community are moderate. Changes to our directed health measures will go into effect Friday, and Health Director Pat Lopez will outline those changes in her remarks today. The second milestone is that everyone age 16 and older is now eligible for vaccine in Lancaster County, and I strongly encourage residents who have not yet been vaccinated to do so. As we see more cases of the COVID-19 variant in our community, it's critical that we all do our part to protect ourselves and our neighbors. And then the third milestone is that the number of residents who are now fully vaccinated has topped 100,000. Over 107,000 individuals in Lincoln and Lancaster County have rolled up their sleeves and been fully vaccinated so that they can protect themselves, their loved ones, and our entire community. And that's nearly 44% of those who are eligible. And we continue to have the highest percentage of fully vaccinated eligible individuals in the state. Getting as many people vaccinated as quickly, efficiently, and as equitably as possible is crucial to our success as we seek to stop this virus in its tracks, help end the pandemic, and resume more joyful and familiar ways of living our lives. Now, the flip side of this coin is that more than half of our eligible residents remain not yet fully vaccinated. So recognizing this, we urge people to continue to take common sense precautions to slow the spread and prevent further illness. Thank you for your faithful dedication to washing your hands, wearing your masks, and watching your distance as we race to vaccinate our community members against the virus and prevent its variants from gaining a stronger hold in our community. I'm really proud of how strong and swift the Lincoln Lancaster County Health Department and our community partners are performing in this race. They continue to host large-scale vaccination clinics and smaller-scale targeted clinics that will help us ensure that vaccines are widely, easily, and equitably accessible. Director Lopez and some of our partners in education will share more about that in just a moment and about the progress we are making together to slow the spread and help end the pandemic. The momentum of our collective efforts is real and growing. And you can help us keep this momentum going. You can help accelerate this progress and help end the larger pandemic by getting vaccinated. To register for a vaccination, visit covid19.lincoln.ne.gov and click on the Vaccine Information tab. Those who do not have online access or who may need assistance can call the COVID-19 hotline at our health department to register, and that number once again is 402-441-8006. And with that, I'll turn this over to Health Director Pat Lopez.
Thank you. As the mayor mentioned, we're making great progress and must maintain our forward momentum to reach our goal of getting 75% of our population age 16 and over fully vaccinated. Let's take a quick look at the data. As of today, more than 156,000 residents have received 1 dose of vaccine, which is over 63% of the population age 16 and above. More than 107,000 have been fully vaccinated, and that's nearly 44% of the population age 16 and older. To help the public keep track of our progress, we've refreshed the look of our COVID-19 dashboard this week in an effort to make the existing information more user-friendly and accessible. We previously shared the bar chart that showed those who have initiated vaccination with the first dose by age group. This is great to show progress with vaccinations, but also important because the first dose does provide some protection against the virus. An enhancement to the dashboard is a similar bar chart by age group of those who have been fully vaccinated. Once again, our community's goal is to get 75% of the population age 16 and over fully vaccinated. As I mentioned, we are nearing 45% of the population fully vaccinated. The age breakdown shows age 85 plus at over 67%, age 75 to 84 at about 72%, and the 65 to 74 age group is nearly 78%. Age 55 to 64 is just below 50%, and the age groups between 25 and 55 are all near 30%, and age 16 to 24 is just above 15%. You will see the percentages continue to rise as more people get vaccinated, especially in the younger age groups, since they just became eligible for vaccine most recently. As we move forward in our vaccination efforts, we continue to strive for a smooth and streamlined process for registration through vaccination. We recently launched a user-friendly online scheduling option so people can more easily make appointments to get vaccinated at upcoming clinics. People click on the existing vaccine registration, then where they can complete the quick and simple registration process, and then set their own vaccination appointments at the covid19.lincoln.ne.gov website. Residents who are already in the registration system will be contacted to schedule an appointment. Vaccination appointments are currently available for this week at 2 public clinics. A drive-through clinic is set for Wednesday at the Gateway Mall site, that is the former Sears, near the former Sears garages. An afternoon evening clinic is set for Friday at the Pinnacle Bank Arena, and there will also be a Saturday clinic at the arena as well. Again, you can register and then schedule an appointment to get vaccinated at one of those clinics at covid19.lincoln.ne.gov. We encourage residents to take advantage of the first opportunity to get vaccinated. Our health department has several other vaccination efforts ongoing this week. Yesterday, we vaccinated almost 70 residents experiencing homelessness in collaboration with the People's City Mission, Matt Talbot, and the Gathering Place. We have also been working with higher education institutions and local high schools to provide vaccine to students age 16 and older. We started vaccinating some students at Friday's first dose clinic at the arena, and those efforts continue this week. Right now, we have a clinic for students from local colleges and universities at the Coliseum on UNL's campus. That clinic runs until 7 o'clock tonight. And starting tomorrow, we will be hosting clinics at local high schools for students and their families and guardians. This week, we also have clinics scheduled at Lincoln Lutheran, which will also include Lincoln Christian and College View Academy. Norris, Waverly, and Pius, the 10th high schools, are also scheduled for vaccine. We are also partnering with Three Rivers Health Department to provide vaccination for students at Raymond and Malcolm High Schools. Next week, we will have clinics at North Star, Northeast, Lincoln High, Southeast, and Southwest. We are pleased to partner with the area schools and offer more opportunities for people to receive vaccine. To further discuss the importance of vaccinating our student population, I'd like to have UNL Chancellor Ronnie Green step up and share some information. We really appreciate our partnership in hosting today's clinic at the Coliseum.
Well, thank you very much, Director Lopez. It's a pleasure to be here this afternoon and to be able to share in the excitement that we have about hosting the vaccine clinic today that's underway on the UNL campus at the Campus Coliseum. Just a short word, we will finish our spring semester at UNL here at the end of next week is the end of our spring classes with commencement coming. It'll be a historic commencement for us. First ever in Memorial Stadium in our 152-year history, and are excited to be able to share that with our families and our graduates. It's been a very successful term for us, and we've been very pleased to be able to continue our operations even in the midst of this pandemic, and to have a very low and limited level of COVID infection during this spring term, including the most recent week, one of our lowest that we have had. So very pleased about that. Director Lopez referred to today, we are hosting a vaccine clinic for higher education in the greater community, not only UNL, but other institutions of higher education across the area, and have been very pleased to have a lot of our students turning out to receive vaccines and to take advantage of that availability. We'll run through 7 o'clock tonight, this evening, and we continue to see those students come to receive vaccines. We are encouraged that in working with the Lincoln Lancaster County Health Department over the past several months, that the vast majority of our faculty and staff in our community of the university have been able to receive vaccination. We're very, very happy about that and very thankful for the partnership with our health department that has allowed that to happen, and I know that has been the case across education. So want to thank you for that work and for making that available for us. We hope that we will see a very high turnout and take rate for the vaccines. It is the most important way, as the mayor has spoken to, for us to stamp out this pandemic and to be able to move forward, and we're encouraged that we're seeing that happen and looking forward to that for the higher education community. Last word is that we have our spring game coming up. It will be the largest event in the greater area in some time. It's coming up here in just a little over a week on May 1st, and we're looking forward to welcoming back, we think, upwards of 40,000 fans in Memorial Stadium, following the precautions that we will have in place for safety of the community, and looking forward to being together again to have that opportunity for Husker Nation. So good to be here today.
Thank you, Chancellor, and I really want to thank the work that's been done by your staff and your team in collaboration and partnership to support what we need to do in the community, not only from testing and contact tracing, but finally being able to provide this life-saving vaccine to our students. We're very fortunate in our community to have such great partnerships with all our educational institutions who've really been focused on doing what's best to protect and provide the educational environment that's needed for children and our older students safely. As I mentioned, we worked with area high schools to host vaccination clinics for students 16 and up and their parents and guardians. Today, Superintendent Corey Warrell from Waverly School District also joins us via Zoom. Thanks for being here today, Corey, to share some insights with the community.
Well, thank you, Director Lopez, for giving me the opportunity to speak this afternoon. You know, I'd like to echo a lot of what Chancellor Green said and what he was talking about, the collaborative effort that we've had with the health department, you know, really the last year. And so we wouldn't have been able to make it through our school year without all of the work and the help that's came from the health department. So we really appreciate that. We're excited to host the shot clinic that will be coming to Waverly High School on Thursday from 4 to 6 p.m. It's a great opportunity for our students 16 years of age and up and their families to get their first dose. And so for us, this has been a long time coming. We were very thankful that we had the opportunity to get our staff members vaccinated. And for the most part, a large majority of our staff has gotten their second shot already. But now we have the opportunity to do this for our students. And so we are excited about that. So, and again, we're trying to work through our school year the best that we can. We still have some major milestones left in our district to hit, things such as prom, things such as graduation. And so all of the support and the help that we've gotten from the health department has really gotten us to this point and will get us through the remainder of our school year into the summer and then eventually back to another school year. And so we're very thankful for that. So once again, I appreciate being given the chance to talk today, and thanks again, and appreciate everything that everyone's doing.
Thank you, Corey. Uh, as we look forward to the clinic in Waverly High School also on Thursday, also this week, we at Norris, this week too. Also this week, we'll hold a second dose clinic at Mount Zion Baptist Church. And we're working on some neighborhood clinics, and more information on those efforts is coming soon. COVID-19 vaccine helps protect you and the people you love. It prevents illness and saves lives. It's a critical tool to help end this pandemic. If you haven't received vaccine, the time is now. The health department wants to continue to ensure that we are clearly communicating the risk of COVID-19 spread and the public health impact to our community. Last week, we shared that the metrics for the vaccination rate and the death rate were added to the existing 5 metrics: positivity rate, case rate, testing, contact tracing, and healthcare system capacity. These 7 metrics of the COVID-19 risk dial provide the most robust description of the risk of spread and the public health impact in Lincoln and Lancaster County as we move forward. As the mayor announced, after being in the mid-yellow for 9 consecutive weeks, the dial is moving to low yellow. After being level for the last couple of months, many of our indicators are now showing improvement. This past week, we saw a drop in the number of new weekly cases from 348 to 264. This is the largest drop in weekly cases in 9 weeks. It is also the lowest weekly case count since late August, just prior to the surge we saw when fall classes began. We are grateful that we are trending in the other direction now toward the end of spring classes. This decline in cases reflected in the 7-day rolling average of new daily cases. For the first time in many weeks, we can see a downward trend rather than a flat or slightly elevated line. The number of cases over the past 3 weeks peaked at an average of 54 per day on April 1st, and since then the average has gradually declined to 38 last week, ending April 17th. The number of tests completed has been flat for the past 9 weeks at about 9,000 to 11,000 tests per week. COVID-19 testing remains widely available in the community, including the convenient drive-through testing at Gateway Mall near the old Sears building. Testing continues to be an important tool in assessing spread and impact in our community. Anyone with COVID-19 symptoms should get tested. The turnaround time for receiving COVID test results continues to be short, with most results provided in less than 24 hours. Our contact tracing also remains robust for follow-up on positive cases. The community positivity rate was 6% for the week ending April 17th. This is down from 7.1% and 7.5% the previous 2 weeks. We have also seen a gradual increase in hospitalizations in Lancaster County over the past few weeks. If we break down the data between Lancaster County residents and those from other communities, we can see that more recently we have more hospitalization from those outside of Lancaster County. The orange line on this chart represents hospitalizations of those from other communities. From April 4th through yesterday, April 19th, we have seen an increase from 7 to 18 patients. In comparison, you can see that Lancaster County resident hospitalizations, represented by the blue line on the chart, there has been some fluctuation, but we are at 18 on April 4th and 18 again on Monday, the 19th. We continue to work with our healthcare system partners to better understand demographics of these hospitalizations and any additional information. Today, we are reporting 44 hospitalizations, with 28 from Lancaster County and 16 from other communities. Death due to COVID-19 has been a hard reality. Fortunately, since vaccinations began, the most vulnerable populations have been more protected, and patients currently hospitalized are averaging below the age of 60 and are being primarily successfully treated and cared for. There were 6 COVID deaths reported in March, and 4 have been reported to date in April. We have been very pleased with the progress of vaccinations in the community. Even as the dial moves down to the lower yellow, we are still asking everyone to maintain caution. We are seeing cases from new and emerging COVID-19 variants. And these variants are mutated versions and have the potential to cause COVID-19 to be more severe, spread more easily, and require different treatments or change the effectiveness of the current vaccines. CDC is reporting that scientists continue to learn how the vaccines protect people from the variants. Today, I'm announcing several significant changes in the local directed health measure. First, the DHM has allowed 75% occupancy, but required that there be a minimum of 6 feet of distance between patrons or groups, limited groups to 8 people, and limited attendance at youth activities and sports. We will continue to allow 75% occupancy, but we are changing the requirement to have 6 feet of distance between patrons or groups and the limit on group size. Instead of being a required, those provisions will move into guidance. In addition, the limit to attendance at youth activities and sports has been removed. Those changes apply to gatherings, youth activities and sports, food establishments and bars, barbershops, cosmetology establishments, and estheticians, body art facilities, and massage therapy. Second, a new exception to the requirement of wearing face coverings has been added. If individuals are in an area that is not otherwise open to the general public, such as a private office or break room, and if every individual is fully vaccinated, they will no longer have to wear a face covering, even if 6 feet of separation cannot be maintained. This will allow fully vaccinated people to meet in the same conference room or work in the same office without wearing a face covering, as long as everyone is fully vaccinated and the area is not open to the public. These changes are made possible by the excellent progress that is made by people being vaccinated in our community. Those of you who have already been vaccinated have made this possible. As we continue to strive for our 75% vaccination rate, we encourage every single person that is eligible to get vaccinated to do it now. That is how we are going to win this battle with COVID-19 and end the epidemic for our community.
Thank you, Director Lopez, and thank you to Chancellor Green and to Superintendent Warrell for being here with us today. And before we take any questions, we want to remind the public that there is another drive-through career fair coming up this Thursday. That fair is from noon to 7 p.m. at Gateway Mall near 63rd and O Streets, and employers in manufacturing, healthcare, construction, and many more fields will participate, and they'll be promoting career opportunities for people with all different skill levels and backgrounds. And we want to make sure people know that they can check that out this Thursday, April 22nd. We also want to highlight that our city's Parks and Rec Summer Program Guide is now available. Copies are available at our rec centers, libraries, and the Lincoln Parks and Rec Administrative Offices on O Street near 33rd Street. In the guide, you will find that the rental of park shelters is in progress, that pool passes are available for purchase, that Parks and Rec will operate all 9 of our outdoor pools and offer Learn to Swim and Swim and Dive League programming this summer. You'll also learn that Summer Day Camp and Nature Day Camp registration is in progress. And of course, group sizes will depend on current health safety guidance, but softball registration is also in progress, and Party in the Parks free community events, information about those are located in this as well. So with that information, we would be happy to take any questions from the media.
Mayor, this is Jared Austin with 1011. I have a question for Pat.
She'll be right here. Thank you, Jared.
Thank you.
Hi, Jared.
Hi, Director Lopez. How you doing today?
Good.
Good. I just had a question. Obviously, we're moving to the low yellow today, and I guess the main question now is, what's it going to take for Lancaster County to get to the green phase where we really see a lot of these restrictions going away?
Well, the restrictions we have in place now are the 75% of occupancy in public places and at events. Otherwise, in wearing a face covering. And to really get to green, we're going to have to try to get to our goal of 75% of our community being fully vaccinated, get our positivity rate down below 5, and decrease our cases. So I think what we need to look at is in the way that what we've been doing has really affected a change here, and that we have such a high rate of people being fully vaccinated in our community, being at one of the highest in the state. So I prefer to look at what we're doing moving forward to reach that goal of getting to 75%, so our community won't continue to have variants of the case in individuals with serious illness from COVID-19.
I'll just follow up with you real quick, Health Director Lopez. You obviously, Lancaster County has the highest percent of fully vaccinated people. I guess, what do you think the county is doing right to make sure people have access to the vaccine?
Well, one of the things is I think that we provided opportunities in a variety of settings, but I think the most important thing is that we have a community that's really listening and really working together to move forward. That's probably the most important thing that we have in our community. You can see that in just the work that's being done if you ever go to one of the large clinics. Those are a lot of our community volunteers from businesses, retired individuals from all over. We have physicians, retired physicians, practicing physicians, nurses that have come out to just volunteer their time, and all the people directing traffic. I mean, I think that shows, that's the best picture I can give you of why we're moving forward the way we are in our community, because as a community we work together and we're getting the message out. And we've been able to, with that assistance of our businesses and all these other professionals, to establish really smooth, efficient running clinics and get people vaccinated when we had the vaccine.
All right, thank you.
Hi, Pat. This is Matt Olbrich with the Girl Star. I just wanted to clarify on the mask mandate. What is being relaxed is private businesses, private workplaces, or places that aren't open to the public.
Correct.
But the mask mandate for like bars, restaurants, movie theaters, malls, all those places is still in effect, correct?
That's right.
Okay.
And Matt, if you look at the CDC guidelines, that's what the CDC guidelines are sharing. So we are not relaxing the mask mandate in public places. That's probably the clearest way I can state that.
Okay. And then the 75% occupants, the youth sports one. So basically, youth sports, be it club sports, LPS, any of those, their only restriction now is 75% of the capacity of their stadium or their gym or whatever. That there's no, 6 spectators per person or anything like that.
No, that's right. And, of course, Matt, we're recommending, we've moved things to recommendations. And I think that's one thing that people forget sometimes, that we're still recommending people do that. And you need to look at what you feel safe with in your environment. And I know in talking with some of the sports folks, some people that are spectators that come want to know that people are keeping their distance a little bit and feel comfortable that way. So it's going to be up to the facilities to work that out. And we're certainly ready, willing, and able to assist them if they have any questions about that. But we do want people to be safe, and we do want them to continue to watch their distance. But, we also want to be moving forward. So this is a step in that direction, as have been many of the steps that we've taken.
Great, thank you. I just have one more question for you, and this is a question that I get a lot. when you talk about going or your goal of 75% of the population vaccinated, a lot of people ask me, do you figure in the percentage of the population that's already had COVID and may, or has had COVID in the last 3 months and may have antibodies? Or you're just strictly looking at 75% of people getting a vaccine?
That's a question. No, we're strictly looking at people who have been fully vaccinated. We're not looking at COVID. You have some immunity for a while from actually having COVID, but we really don't know how long that is. And we do know when you're fully vaccinated, with the 2 vaccines we currently have available, you're 95% or so.
Okay, thank you.
Uh-huh.
Okay, well, thank you again for tuning in. Thank you for what you are doing to help protect our community. We're grateful that the sun is coming out from behind the clouds today. We want to thank everyone in our community who has been working hard to take care of one another. We are seeing better, brighter, sunnier days ahead. We just have a bit further to go, so let's stay the course, Lincoln. We've got this. We've got this together. Thank you.